Hi, I'm Tanya, and for my disability pamphlet, I chose the disability Childhood Disintegrative Disorder. So this is my pamphlet, that's the back, and then this would be the inside pages then. So childhood disintegrative disorder is also known as Heller syndrome. And this disorder is one of the 5 disorders listed under the pervasive developmental disorders, known as PDD. So PDDs are a spectrum disorder and they usually include behavioral problems. The disabilities included in PDD are autism, childhood disintegrative disorder, which I'll be calling CDD, Rett syndrome, and pervasive development disorder not otherwise specified. CDD is defined by the regression of developmental ability and function in social, emotional, motor, and language skills. It is incredibly rare, happening in only 1.7 children in every 100,000 children. CDD is also considered a low-functioning form of autism, and the biggest difference is that autism does not show the regression you see with CDD. CDD also usually develops much later than autism. Characteristics of CDD vary depending on the child. It is difficult to define symptoms by age because CDD can affect children at different ages and stages of life. A child typically will have 2 years of normal development before symptoms are apparent. Symptoms most commonly begin between ages 3 and 4, however, they can occur up until age 10. Children with CDD develop normally for a couple of years and then they severely regress. And this can happen suddenly within just a few days, or it can be spread out more over time. It can even be so severe that children are actually aware of the changes and they might ask what is happening to them. Usually there are no prior abnormalities. I'm sorry, I lost my spot. Alright, so one example would be a child who is able to communicate in 2 or 3 word phrases, and then they might suddenly lose that ability, and then eventually they could become nonverbal altogether. So it's kind of just like going backwards developmentally. Social and emotional problems can also be present. A child who previously maybe enjoyed cuddling might become unfavorable to that physical contact. Children with CDD show loss of skills in at least 2 of the following areas: expressive language, receptive language, social and emotional skills, adaptive self-care skills, bowel or bladder control, and play and motor skills. Irregular function also occurs in at least 2 of the following areas: social interaction, communication, repetitive interests, or behaviors. It is easy to see why CDD is so often compared to autism. There are similar social and communication deficits when compared to those with severe autism. One thing to note is that there are not usually any physical abnormalities in a child with CDD. There are also no specific confirmation signs either. Many of the symptoms end up leading to medical testing to rule out other diagnoses, such as mercury or lead poisoning, brain tumor, HIV infection, or childhood schizophrenia. These are only a few examples. Services that are offered do depend on the child's individual abilities and needs. There are many types of therapies available, and behavioral therapy is the most commonly used. It can focus on reteaching skills that have to do with language development, self-care, or social skills. Environmental therapies may also be used. They could include sensory enrichment, for one example. And medication can also be prescribed. However, the medication is usually only used in treating specific symptoms, not the disorder itself, as there is no such medication that exists to treat the disorder itself. Loss of skills usually will reach a plateau by age 10, but it is possible to see some small improvement. However, this is very rare. Long-term impairment of behavioral and cognitive function is overwhelmingly likely. Intellectual function and adaptive skills are usually profound and leading to severe intellectual disability. Epilepsy also can begin to develop as a symptom, and children will generally require lifelong support. Life expectancy is normal. So now looking at educational implications, there are many teaching strategies available based on individual symptoms. So for anxiety management skills, teaching strategies might include modeling, direct instruction, check-in symptoms, labeling of feelings, etc. And for personal care routines, they could include picture schedules, para support, student checklists. For assistive technology, there are speech-to-text or text-to-speech options, as well as graphic organizers and many others. And these are just a few examples. There are lots of teaching strategies available. Cultural implications around developmental disabilities are vast. Some cultures view a disability as an act of God. Others believe a disability is creating shame on a family and it's attached to a stigma and negativity. And this in turn does make it difficult for families of that type of culture to reach out for support and assistance. Some cultures believe that having a disabled child will not be acceptable in the community. They may isolate themselves. And then some may believe that developmental disabilities are caused by mistakes made by parents or ancestors. Others believe medicine or illness experienced during pregnancy is to blame. So these influences can have an impact on whether families seek help, what treatments are used, what resources are available, and relationships between families and care professionals. Healthcare professionals and educators alike should remember to be mindful of these cultural differences. By being sensitive to these issues, we can provide helpful resources and treatment that will benefit the child. While there are a few resources for CDD in general, there are many for PDD as a whole. And because of this, many sources of info and support for families experiencing CDD can be found on autism-related websites. There are just a few examples listed that have adequate parent resources available, so you can see them here. So the Autism Project and the book Autism Speaks have been cited as good resources for parents, and these other ones are just some that I found that are more general for pervasive developmental disorders, since I couldn't find much for CDD alone. Okay, that's it. Thank you for watching.